welcome to my channel. So this is my second video. On my first one I was telling you about how I injured my left foot and how I got, because I injured it abroad, how I got back to United States, home, and so my first video was a little bit too long. I'm famous for not being too good about summaries. So I was in pain. My foot was this big, and my accident was on October 4th. I just did not know, what was the extent of my injury. So I made an appointment with an orthopedic doctor. She, as soon as she saw me, that was Monday, the 11th, Veterans Day. She saw the x-ray and she said, you have a calcaneus fracture. I never heard of that word before, so for me it was like, what? What is calcaneus? And like, what does that mean? And she said, well, it's your heel, and most of the time, these kind of fractures are really serious and they are not easy to fix, or it takes a long time to recovery. So my face started to like say, what is going on? Why? Like you have all these thoughts coming to your head, like, like, why did I do this to me? If I could go back in time, all these things. What's gonna happen? Am I gonna be able to walk again? Or, my foot was, am I gonna be in pain all the time? All these things. And she said, well, we're gonna have another x-ray and a CT scan, and then we'll evaluate and see. Most of the time these injuries require some kind of surgery, and the recovery is about 4 months, up to a year to fully recover. So my head was spinning, like, my job, how am I gonna get around, who's gonna help me. We don't have any family here. My husband and I are originally from Argentina. So we have two sons, but they had their lives, and they're, they don't live around in the area where we live. So all these questions that, of course, are normal, and they just start coming and coming and coming. So I was like, okay, calm down, we'll like figure this out. Maybe she's wrong, I was thinking. So she put me on a splint and gave me new crutches and said, okay, just, go home. And then on Friday, when I get everything back, the CT scan, and I had to go somewhere to get the CT scan. That's why, it was not there right away. This is like an orthopedic clinic. It's not a hospital. So, so my home, we live in a big house with, stairs to go up the bathrooms, and on top of that, my house we are remodeling, so it's a complete mess. So wrong time. But my husband, as I mentioned before, during the week he works in Massachusetts. So we have an apartment in Massachusetts, and the only person that could take care of me was my husband. So I decided to just move to the apartment in Waltham, Massachusetts, and wait there until Friday, when I was going to talk to the doctor again about, what was gonna happen. Meanwhile, we always think that it's something serious, and not even that serious. You need, or something, when you have to take a decision about your health, it's important to have different opinions and talk to another doctor and see, what this other person thinks. So during the week, we are lucky that we know people in the medical field, and so we ask different people and friends, and we got recommended to go to Massachusetts General Hospital in Boston and see Dr. Di Giovanni. So, of course, before you go see a doctor, I always check the credentials and experience. And, now online you have a lot of information about your physicians, and, years of experience. And sometimes patients leave comments, which, that helps too. So we made an appointment. This is Monday. We made an appointment for Thursday. So very quickly we got an appointment. It was great because I wanted to get a second opinion before my conference with my other doctor in Connecticut. So we went to see him. As you can imagine, I was super nervous because there's so much going on. Meanwhile, I'm like trying to figure out what I'm gonna do with my schoolwork, and talking to principal and HR and all that paperwork that you have to do, because if you have a job, my job is important. I'm a teacher, so someone needs to take over my classes. And luckily, my school district was very supportive, and so I didn't have to worry much about that. Besides, I had a lot of sick days. That's another thing that I'm lucky that, I had sick days. So when we went to see Dr. Di Giovanni, I have extra x-rays. And when he saw me, after talking to him for a few minutes, I knew that he was the one. If I had to have surgery, I felt super confident that he was the right person to do my surgery. He has a lot of years of experience. He works for a very, 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 very good and hospital in the United States. It's one of the best hospitals in the country. So I knew that I was in the right place, and of course you have to ask a lot of questions. He was with the doctor, the fellow that was there with him. She also was very, very nice. So we talked about different things. First, he explained what a calcaneus fracture is. He told me that my fracture was really bad, that I broke my calcaneus on my heel in many different pieces. And he didn't know how much of the tendons were going to be compromised. If it was a break here and there, or so, until he went in and opened up. So he was very clear, but honest, which it's important from the patient's view, that your doctors don't sugarcoat everything or don't tell you everything, because then surprise, this is what's gonna happen. So he was very friendly as well. So he gave me an example of a mirror. He said, for example, if you break a mirror in many pieces, I'm going to get all these pieces and put them all together, and I'm gonna be very careful, and I'm gonna try my best to have everything in its place. But it's never gonna be the same mirror. And that really stuck in my mind because it's true. Or he gave me the can of soda. If you step on it, it's gonna be super flat, and then he said you have to put it back in shape. It's not gonna be exactly the same. So I was kind of like taken back, like, oh my God. So I asked, am I gonna be able to walk, and I'm gonna be able to do the activities? Because that's what I want to know. I can go through surgery and recovery, and because I know I can do it. I know that was not a problem for me, but what's the outcome? And really, nobody knows exactly what the outcome is. And that's the thing with this kind of fracture, that you can read about it, you can talk to people that had the same fracture or surgery, and it's never the same. So he said, this is up to you. He said, many times it's up to the patient, how much effort you're gonna put into it. You need to follow really well the procedure after surgery, and some people will have more pain than others. So there's no a perfect answer, I guess. He said that the recovery was gonna be long. Uh, in my head, I have to think a year, because I will be walking in like 4 months, but slowly, the healing will take longer to be as normal as it could be, I guess. So he said that some people decide not to go do surgery. So you have surgery versus no surgery. Um, there are a lot of factors. He was explaining that age is a factor, your health. If you are overweighted, overweight, or you are smoker, you have diabetes. Those are all things that are not good factors to have surgery. He said that he would not do it. But by looking at me, and he read, of course, my health history, I don't have any issues. And he said, you can have this surgery, and if you decide to do surgery, I will do it in the next few days, because your fracture it's not good. So I asked a lot more questions. What was the surgery going to be like? He said, well, we open you up, we look inside, we put screws and plates and rods or whatever you need to join all those pieces. You might need a bone transplant, and then we'll see. Hopefully there's no any tendon involved or broken, but if you then need that, we'll fix it. And then you'll go home. You'll have to have your foot elevated for 3 weeks, full 3 weeks. He said that's the most important thing that you should be doing on your first 3 weeks. So no moving around. The 3 weeks are super important, because you want to prevent your foot to be too swollen, and also you want to decrease the pain, because as long as you have your foot up, You'll have less pain, and any kind of inflammation. So I said I can do that. I mean, it's not the best because you know um, and then after 3 weeks, you will see you the first week after the first week, and then we'll see you after your 3 weeks, and then after your 3 weeks, we will evaluate again and see what's next. We might put you in a cast or boot. We'll see. And then, you have 4 more weeks, at least 3 or 4 more weeks, and then we'll see, we'll x-ray and then we'll see what's next. So right away, I just decided that I wanted to have surgery because, I wanted to start this healing process. That's something that when you have an injury and you know that, you will need surgery and the recovery is going to be this long, you want to start that. You want to start it right away if you can, because it is important for you physically and mentally, emotionally. So we just did all the paperwork, and the appointment. As soon as I got home, I was called and they made the appointment for Monday. So I didn't have a long time to think about this, which is good because why do you need time to think, and if you already decided to do it. And during that time, I had to arrange a few things, my job, what am I gonna do these 3 weeks. So it's important to plan ahead and think, okay, I'm a reader, I like to read, I like to knit, I like to do things, because you have to sit there for 3 weeks with your foot up. So you wanna have your mind, entertain and do something, because it's if you work from home, you can still, I guess, work from home, but I wouldn't recommend it the first, few weeks, because you're tired, you just don't sleep well, and it's now you are taking pain medications. So just try to rest. And so my surgery was on Monday. There are a few things that I'm thinking, it's super important to pick the right doctor. This is a very, very complicated surgery. Like I said, everybody has different kinds of injuries and fractures. But you need a doctor that has done a lot of these kind of surgeries. Actually, Dr. Di Giovanni told me that when I went back to see him, that if this was something that he had to do at the beginning of his career, it would have been hard because he didn't have a lot of surgeries like this. So we asked him, how many surgeries have you done like this before? That is important. Also, of course, you want to search credentials, and well, of course, he's a doctor and he's an orthopedic surgeon. So, but check your insurance, of course, if your insurance will cover this, because that is important as well. And then you have to go back and visit, for post-op visits. So you don't want to be driving a lot of miles back and forth. That's the reason I moved here, because it was close. And just feel, you have to have that feeling that you communicate with your doctor well. And that's what I liked about my doctor, that he listened. I was asking questions and he was listening to me and he was answering me. He was not rushed, like many doctors, they have 5 minutes, blah, 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 boom, next. So he listened to me, he took his time, and that was very, very important to me. So just think about those things before picking the right surgeon or your orthopedic doctor. Then think about surgery. Ask questions, and I know that he was telling me that you could put a cast and nature takes place. But in my case, after I had my surgery, he said, you had to have this surgery really because it was a mess. So that's about pretty much how I picked my doctor, and my surgery was Monday. So I will tell you a little bit more about my surgery on my next video, but a few things, make sure that you're ready before your surgery. There are a list of instructions that your doctor will send you. Mm, with of course, if you're taking medications, how long to take your medications before your surgery. Also, if for me it was during COVID, so I had to have my COVID test before. Also, before your surgery, the night before, you have to stop eating at a certain time. Also, you have to stop drinking a few hours before going to your surgery. Many doctors will ask you to not have any, you know, any polish on your color on your nails or your toes. Don't shave your legs. Also, don't put any makeup when you go to your surgery or lotion in your body. Those were instructions that I was given by my doctor. Also, you don't take Tylenol. Will take Tylenol, but ibuprofen will slow the bone growth. So after your surgery, you won't be taking any ibuprofen, just Tylenol. So there are a lot of things that you have to think about it. Also, if you ask your doctor for a temporary parking, handicap parking permit, and do it ahead of time. I didn't do it ahead of time, so I got it a little later, but that will help when someone is driving you to places, because you'll have a cast, you'll have to walk on one leg and using crutches, or a walker or a scooter. So it's a lot easier, and later on, when you start driving, for me it was my left foot, so I'm thinking I will start driving later on when I can, put my foot down, of course. But it's something that will really help you. So that's something that you wanna think ahead. Think ahead how you're gonna move around in your house. I text a lot of friends asking if they had anything, because I didn't want to really buy all these things. So I asked, and it's amazing how many people have, like walkers and crutches and wheelchairs, because they all know someone and they have them somewhere in their basement or attic and they're not using it. Also, there are donation centers, where you can go and get them for free. So I got from friends the weekend before or the weekend after, I can remember. Around that time, I started collecting things from them. So I got a walker, I got a wheelchair, I got a scooter as well. So I was ready The scooter came a little later. So at the beginning, I was walking with crutches, and then when I got a walker, I used the walker because it was a little more stable with the walker than the crutches. And after a while, you get really tired walking with crutches. So those are things that you need to think ahead. What are you gonna use to to bathe or to wear. You need comfortable clothing, especially your pants. Have depending on the weather. You're gonna wear a lot of shorts or sweatpants because they're easier. Remember, you're gonna have a splint or a cast or a big boot, so you won't be able to put tights or small like pants. So just sweatpants and shorts if it's warmer or your house is warm, and then comfortable clothes to just dress and undress yourself, or someone can help you, but it's a lot easier. Big t-shirts for bed. I got a long big t-shirt, so it was easier. When I went to bed, I got also a little bench ahead of time to put in the bathtub. I didn't take showers or baths the first 3 weeks. So I just bought these wipes. I will show them to you later. And those are great to clean yourself. And then I wash my hair on the kitchen sink. Someone, my husband and my son that came to help me for 3 weeks, they helped me. So think about all those things, having nearby. And maybe if you have a living room, a sofa where you can sit there, and something where you can put your food up. I bought also these big pillow to put on my bed. So I use that as well, and I put pillows all piled up to put up my food up. So there are a lot of things that you can do to make this time a little more enjoyable, and time can go by faster. So I can't think of anything else right now, but have your prescriptions ready, because you will. I don't know how, if you have help at your house, if there are other people that can help you. Hopefully. Surround yourself with people that are positive, that they will encourage you, right? Don't go on the websites and Google and read a lot of negative stuff, because that's not gonna help you. Like every experience is different. There are things that are going to happen for sure, but there are other things that could be different. But that's why I'm here, because I like to share what I'm going through, and what I'm going through is not better or worse that you are going through or you are going through. So be positive. Think about, this is something that I'm going to do, and I'm going to be good. I'm gonna follow everything. I'm gonna have a good set of mind, and try my best to get to the end. And that is one of the most important things, to be positive and have a little bit of fun. Have a little bit of sense of humor. That helps. Laugh and watch a lot of funny movies, and that, it's, for me, it's super important. And have people to talk to, friends and family. And I have friends, unfortunately they don't live here, they live in my hometown in Connecticut, so I couldn't really have a lot of interaction with them. besides, texting and talking on the phone. But I hope that you do that, you can do that. Okay, guys, so this is it for now. I hope that you enjoyed my story, and give me thumbs up, subscribe if you like. I have also an Instagram page where I put a lot of pictures and I tell a little bit about my story as well. So see you next time.